I would like to ask for your permission to use this video for educational purpose and on internet.
That's fine.
Now, tell me about your symptoms before the surgery.
Well, before the surgery, I was getting pain down the right leg, and it was like an electric shock, and it was like a cold, icy shock also.
How far down was the pain going?
It went all the way down into the calf.
In the calf?
Yeah,
Okay,
all the way down.
How bad was that pain?
That was pretty bad. It was very incapacitating for me at that
Yeah,
time.
yeah, and I'm going to just turn around and show what you have. You had a previous lumbar fusion, but that was many, many years ago. But about 6 months ago, we did what we call sacroiliac joint fusion, because when you came to me, we found out that your problem is actually your sacroiliac joint. Even though the pain was going to the leg, when we injected your sacroiliac joint, your pain did get better temporarily. Is that
Temporarily, yeah, just a short time. Yeah.
Yeah, and that is exactly the diagnostic of the sacroiliac joint. We numb it up to see if 75% of the pain goes away. We are sure that's a problem, and then we go and fix it. How did we decide to fix only one side? We fix only the right side.
Well, simply because both would have incapacitated me in my recovery. Worried about blood clots. All that sort of thing. So one at a time was the best decision, and we made that together.
Yeah, and we decided to fix only one side because we asked you not to walk on that side for a while.
That's correct. I had to do tiptoe on that side for quite a while.
And if we fix both sides, you can't walk.
No, you couldn't
and
do it.
And then that would cause blood clot, a whole problem, a group of problems that we didn't want to deal with.
That's correct. Yeah.
Now, first of all, we did that surgery about 6 months ago. Tell me, how did it go and how is the leg pain?
There's no longer any leg pain going down. That symptoms or that pain I was telling you about now is gone.
That's gone.
Yeah.
Now, when did it go away? How long after the surgery did that pain go away?
Oh, almost right away.
Almost right away.
Yeah.
So even though we are, for a long time, we had no understanding why sacroiliac joint would give a patient leg pain. Now, this is a fact. We know it does because the nerve that goes to our leg, they have to traverse over the sacroiliac joint, and they can be inflamed if the sacroiliac joint is inflamed. And magically, we now understand now the sacroiliac joint can easily give people leg pain. And that's why it confuses us with the lumbar spine. And this is just the knowledge we have gained in the last few decades. Now, we fixed only the right side. Now, first of all, I tell all my patients, in half of the people that we fix one side, we need to go and fix the other side. But in half of them, actually fixing one side, people can use it more. That take the stress off the other side, and then we don't even have to go and fix the other side. How is the other side doing?
Well, the other side does have some pain in it, but right now I think it's certainly livable.
Okay.
And I would assume that we would decide together that we'll take a look at it over the next months and see what's necessary, see how it develops.
And you're fortunately at this point in the group of people who other side is livable.
Yeah.
Because anytime it's not, you just have to go and fix it. Do you remember the surgery?
Yeah, I sure do. Yeah.
So, can you describe for the people who are going to watch that, the surgery and how long you stayed in the hospital and the whole step a little? Would you mind to just describe?
Yeah, we checked into the hospital in Alexandria.
Yeah.
And about a half hour later, we went in for the surgery. Didn't have to wait long.
Mm-hmm.
And the surgery itself was, I think, less than an hour.
Yeah, as a matter of fact, your surgery was 25 minutes.
Yeah. By the time I came out of the anesthetic and all that, and by I think an hour or two later, we were on the road going home.
Excellent.
Yeah.
Now, and you did use a walker, correct?
Yeah.
How long did you use the walker?
I used that walker quite a while until we, got over the step on the tiptoe.
Yeah. And generally, we ask the patients somewhere between 2 and 6 weeks to use the walker.
Yeah.
And obviously, if in doubt, rather using it longer. And especially, I think our surgery was in winter, right?
Yeah.
So we don't want anybody to fall. Rather, longer than shorter.
Yeah, we took that whole time to do it exactly what we were advised to do. So,
good, excellent.
yeah, we followed that exactly.
And it seems that the surgery and your follow up and so on, that you follow those recommendations. That's why that's why you're getting better on that side.
That's correct.
Regarding the other side, We are just going to watch it until you tell me it's not livable. Then we go and fix it.
Agreed.
Any other question or comment?
Not at all. It's been a very successful surgery.
Thank you very much. I really appreciate your interview.